Good morning. I'll have to speak English.
It is indeed a great honor to be here. I have been working with Fundação Maria Cecília Vidigal for many years now, a great partner, and that helped us a lot in the city of Rio de Janeiro, where we could develop a very interesting and innovative model of early childhood education, and we'll talk a little bit later on that, and build more than 200 early childhood centers in 4.5 years. So it was based on this new model. And I have to say that, yes, my emphasis is on education, but it was key to our strategy to be able to work together, education, health, and social protection. And I was very happy when I joined the World Bank on July the 1st to see that this is also part of the strategy of the World Bank, to work together the three sectors, because you cannot ensure a healthy childhood and a future healthy adult without putting the three areas to cooperate, which is not easy. Whoever has worked with policy making know that it's very difficult to put the three secretariats to work together in governments, or the three ministries, depending where you are, at what level you are. But it is central to the effort of early childhood development to put the three areas working together. Before I start, I would like to say that the forum on investing in young children globally it is very important, and it has a key role when it comes to gathering information from many partners. Yesterday I was able to talk to the Dean of UCLA, Jody, on information that we need to make good recommendations to governments and to policymakers. And we at the World Bank, we are very happy to be one of the sponsors of the forum, and to have helped in the past, previous to my arriving here, the core group with the organization of the first two forum meetings in DC and in Delhi. And we look forward to helping in Ethiopia. I'm not going there for that specific reason now, but we are looking forward to helping them. Let me see if I'm successful in... Okay. Yes. Just to show some young... We need to see the children. Children should be at the center of everything we do. So investing in young children is one of the smartest investments a country can make. And the first years of life, as everybody knows here, are crucial to a healthy development. And that's just the start. Children need regular mental, social, emotional, and physical stimulation, along with health care and proper nutrition to keep their development on track. But also, we have to look carefully at three areas. Quality preschool programs. It's not enough to enroll every child in preschool programs. In Brazil, I can say we, we have, as a Brazilian, we have the goal to ensure in 2016 that every child goes to early childhood programs. But it's not enough. It has to be good quality program. There are studies that show that bad quality preschool programs are even detrimental to the child development. But even though this is important, in low-income countries, parents don't always have this opportunity, either because the private sector offers pricey alternatives. The government has not invested in preschool programs, or because parents don't understand the importance or the benefits of such programs. There are a range of options when it comes to preschools, from low-cost community models, when you don't have the government investing in it, that meet just a few hours a day, to full-day, more expensive programs, sometimes within the walls of primary schools, which is not ideal, but it's better than nothing, especially if quality is inside these programs. As I mentioned, not all parents are aware, and that not always government invests. So too few children benefit from early childhood development services. Less than 50% of the 3 to 6-year-old children in developing countries are engaged in any form of pre-primary education. And only 0.1% to 2% of the GNP in many developing countries are spent in preschool education. Our impression is that governments are not aware of the importance either of these investments. And as is well known here, especially among the health professionals, 1/4 of the children under 5 worldwide are physically stunted. That means 162 million children, with 56% of them living in Asia and 36% in Africa. This has to be changed urgently. Wait. I'm hyperactive at a great extent. ADHD. So how can countries devise low cost, if they don't have the resources, approaches to offering early childhood services sustainably, because it's not consistent to have an effort and stop, and the stop-and-go approach won't help young children. A key question is to expand early childhood ECD coverage at low enough cost so that it is affordable and the government can continue to invest. I'm not saying that all countries have to take the low-cost approach. For countries like Brazil, where important investment has already been made, it's important to continue in the route of quality, but we have to ensure ECD education programs for all, not just for the ones that have already invested, and looking after quality at the same time. The World Bank works with countries through multiple entry points to invest in young children. Our portfolio includes investments across health, nutrition, social protection, and education practices. We are organized now by practices, and the three practices are working together to make a big offer for governments on loans and policy advice, loans, grants, and policy advice, so as to ensure that this area is covered. On child nutrition, including including food fortification, community nutrition, and food security. On maternal and child health, including promotion of breastfeeding, prenatal care, newborn health, immunizations, and child survival. Early childhood care and education, including pre-primary education, school readiness, and parenting education. It's important when we talk about school readiness to understand that preschool education is important not only to prepare for basic education, but it is, in some sense, an end in itself. If you can have happy children being developed, it's not important just because of education, the future education. It's important at the present. It's important to have healthy children, for them to be happy while they are children. It is related to a basic child right. Family support and inclusion, including social assistance, safety net, and conditional cash transfer. I think this country has been an example for the world with the Bolsa Família. In Rio de Janeiro, we have complemented Bolsa Família cash transfers, giving additional money with conditionality related to early childhood programs, including attendance at crashes and preschools, parents participating in parent and teachers meetings every 2 months, the school for parents, it's a condition, or if the parents don't want crashes, on an alternative Saturday program, so that kids can be at least monitored from a health perspective and social protection perspective. And central to all this, as I mentioned before, an integrated multi-sector ECD projects and evaluations, including integrated health, nutrition, and education interventions, impact evaluations of ECD, and support for governments to improve ECD policies. Just to give you some numbers, the numbers are not so important as the trend, to see that ECD is at the center of the strategy of the World Bank, Learning for All education strategy. It starts with invest early. So it is in our education strategy. And in the last 14 years, we have invested nearly $4 billion in ECD through multi-sectoral projects. But if you notice what happened in fiscal year 11, you can see the upwards trend in investment. And when I talk about investment, it's loan, grants, and analytical work, studying what matters. It's very important, it's central to the World Bank, the idea of assessing experiments so as to see if there is evidence to scale up and to recommend governments to invest on that. Those are just some examples of our our analytical work and that we have done lately. We have a guide for policymakers making recommendations for early childhood. And as Claude mentioned when she was talking about health, our intervention or our initiative starts with pregnancy. So not when the child is born, because if the mother has a non-healthy pregnancy, it can have bad outcomes for the child. So strategies, I won't go into details due to my limited time, but we cover pregnancy, birth, the first 12 months, the first 24 months, on nutrition, health, water and sanitation. Water and sanitation is central to child health and also brain development, education. And when we talk about education, it's not only the child's education, but maternal education as well, ensuring that parents would know how to care, to build bonds, healthy bonds with the child, and also to stimulate the brain, read to the child. Just a quick example from Rio. It was centered to our school for parents in Rio. Every 3 Saturdays a month, we have a library of baby books that can be lent to parents to bring home in vulnerable areas. And this is for the Bolsa Familia children. And they have baby books at home, and we give them baby books for them, not only from the library, but for them to build their own library. Just to give you some examples on education, including certainly crashes and preschool. And social protection on the cash transfer system and other modalities. On this, while there has been an uptake in the last decade for early childhood investment, resources for ECD remain low in many countries. There's not only good news. This is in part because policies and programs related to early childhood development are complex and managed by multiple ministries. I was talking 2 days ago to Constanza on the difficulties of putting the ministries that are important to early childhood to work together. Sometimes the ministers agree, but in the bureaucracies of each ministry or each secretary, depending on the level, there is resistance to working together, and this is part of our problem. And this has to be central to policy recommendations. In addition to the guide of policymakers that we prepared, we just launched an e-learning course on ECD. We want to compete, I'm just joking, with IDB, who also has a very good e-learning course. We have just launched in October. I would strongly recommend it's open to everyone. It is not translated, Sophie, in Portuguese, it's not yet. But it is translated in Chinese, if you can choose either English or Chinese. The course consists of 3 interactive web-based modules with 15 topics of total learning time, approximately 4 to 5 hours. 3 important modules: why invest in early childhood, what matters for early childhood development, and how should early childhood interventions be implemented. On impact evaluation, let me very quickly talk about evaluation. I am a policymaker. I've been a policymaker all my life, working for governments. And sometimes we wonder why institutions like the World Bank and other institutions invest so much in analytical work, including impact evaluation, as if it were losing resources, not investing directly into action. But how can we know what matters and what doesn't matter? What brings good outcomes, what doesn't? So impact evaluation done by the World Bank or by partners are very important. This is, I'm bringing in the example of the impact evaluation on investing in early childhood in Mozambique. And Sophie is here. She has worked for years. Sophie, so that people can, she is la crème de la crème from the World Bank in early childhood. And please approach her at the break, because she can provide further details on what we have done in early childhood in Mozambique and the lessons learned. And she speaks Portuguese with a Mozambican accent. So Mozambique impact evaluation, just to give you one example, to test the effectiveness of low-cost preschool programs on children's enrollment in and readiness for primary school. We supported this study of an early childhood development preschool program run by Save the Children. The evaluation showed that children enrolled in preschool were better prepared for the demands of schooling than children who did not attend preschool, and that they were more likely to start primary school at the age of 6. Based on these results, the Ministry of Education of Mozambique has begun to work to expand the community-based preschool model to reach 80,000 kids in its 3rd year. World Bank supported researchers are working right alongside the government to evaluate the scale up. I'm going to finalize, because I don't have the time to explain everything. Perhaps at the Q&A session we can invest a little. Talking about the results from the impact evaluation in Brazil on the Rio de Janeiro Daycare Center program. It was a research done by David Evans and Pedro Linto from the World Bank, targeting 0 to 3. And coming from disadvantaged households. The program was based on full-time daycare. In Rio, we had this option of full-time daycare with a program that has even a curriculum for early years in specialized centers with teachers since we don't take 0 to 3, but 6 months to 3 till 5 years old are in these centers, because we don't want to have children in centers and harm breastfeeding. And so, but we have school for parents attached to it. Specific instructional toys and material for children, involvement by parents to foster good parenting practices, and in total, now we have approximately 400 daycare centers in Rio. Still, every new daycare center that we build, additional parents want to enroll their children, so we always have parents that want to register that their children but cannot. So we decided to do an affirmative action, which means that from parents from Bolsa Familia has absolute priority. And that was a tough discussion, because parents were saying, well, but parents that work versus parents that don't work, it doesn't matter. We have teenage girls that need to go back to school, and they won't find jobs if they have to take care of the children. But it's parents' choice. It's not mandatory. If they prefer to stay with their children or have a grandmother or grandfather who wants to stay with the children, they can go to the Saturday program and the school for parents. Among the children from Bolsa Familia, there is a priority for children with disabilities. And they are not separated from the other. We have children with disabilities together with the other children, just additional support for when needed. And so the evaluation is going on. Results so far are showing, are being very consistent and interesting, but I'm eager to see the long-term assessment and evaluation of the results of such a huge and important investment. Investing in early, I won't have the time to go through this. I just want to say one final word, which is, see, everything that I brought and could not cover, but just to say that we need to level the playing field, and early childhood development is a wonderful strategy, and that yes, we are committed to change the world, starting at a very early stage with the small children. Thank you very much.